Welcome to the Bioptimizers Awesome Health Podcast. And now here's your host, Wade T. Lightheart.
Want awesome health? How about doubling your energy? With our free Awesome Health course, you can get a new video and lesson every single day for 84 straight days. The course covers everything from optimizing your digestion, nutrient intake, correct health issues, including weight, skin, energy, immune system, and so much more. The course could easily be worth $200 or $300 for, and yet it's 100% free when you go to bioptimizer.com. That's bioptimizers.com. Once you're there, just enter your name and email to get the first 3 phases of the Bioptimization report. You'll get the report immediately and begin getting your video lessons each and every day from there on in.
Good morning, good afternoon, and good evening. It's Wade T. Lightheart from Bioptimizers with another edition of the Awesome Health Podcast. And today we are going to talk about the future of telehealth and health tech, what the government needs to do in order for telehealth practices to thrive, balancing work as both a doctor and an entrepreneur. And we have an extraordinary expert here today who is licensed in all 50 states plus DC. Yes, DC is not a state. And known as America's doctor, Dr. Laura Purdy, MD, is a board-certified family medicine physician who has been featured in Vogue, on Fox News, ABC, NBC, and NPR, among others, as the nation's leading authority and thought leader on the future of digital healthcare. Dr. Purdy's in-depth digital health expertise comes from more than a decade spent providing and directing primary care for hundreds of thousands of patients of all ages from all walks of life. And she joins us today, of course, online. So, hey, welcome to the podcast.
Hi, thrilled to be here today. Thank you for the introduction.
So here's a radical transformation has happened in healthcare, sort of secretly, but definitely accelerated during COVID. I think and that is the ability to be able to contact a medical doctor, have consultations online, and this is transformative for health. Can you share a little bit about what got you started in this whole area as a medical doctor? Because it's certainly outside of the traditional practices that have been going on for years, and it's a radical departure. What got you interested?
I'm happy to share the story. So when I talk about telemedicine and where it's come from, or sometimes we say virtual care, digital health, there's a lot of buzzwords, but they all mean the same thing, which is, just to define the terms, healthcare where the doctor and the patient are not physically located in the same place. That's what we mean. So honestly, it has happened not only for me, but for everyone else, out of the need of, scarcity, few resources, and almost like a mandate to change. My personal story was that I wanted to put my children in Montessori school, and I was in the military, and in the Army, there's no way for you to make more money. And I could not afford to put my children in Montessori school. And I also couldn't find a way to make more money working for the US government. It just is what it is from a paycheck standpoint there. So I was looking for a way to get to work more, make a little more income so that I could put my kids in the school I wanted. But I really didn't want to, and also couldn't slug out more shifts at some other hospital across town. So I had a friend who said, hey, I'm doing this telemedicine thing, and you can work from home, or you can work on your downtime, and you can make a little bit more money. And I said, well, that's perfect. I was pregnant at the time. I said, that's exactly what I need to do is to do that. And the second I saw what it was like to have this novel alternative career, I said, this is not just what I need. This is what everybody needs. The patients, the hospitals, the doctors. I mean, we all need this, and have never looked back.
One of the things, and what's interesting, is I've been a digital entrepreneur since 2003. So literally, Matt and I built Bioptimizers, and we have people working for us on our team in virtually every single continent except Antarctica, which is remarkable. And so I'm an old school veteran in this idea. And then all of the technology that we were using that everyone thought was confusing and odd and obtuse, and how do you build a company and an organization, became to the forefront of the biggest companies in the world during the pandemic when everybody couldn't meet up. But it seems that you were preemptive to that concept, into that ideology. And what do you think has made telemedicine possible, and where do you think it's going in regards to on both sides, for the patient as well as the practitioner? Because from a time efficiency and just the logistics of driving to a hospital, or maybe you have to go a long ways away, especially if you're in a rural community, to access great care. Also for doctors who have an opportunity to maybe live in a place that they would prefer to, that have better economic conditions relative to income. There's a lot of different factors. So I'd like you to break it down from your perspective of what are the advantages and how do you see that moving forward from the traditional model that we're used to?
Sure. So where did it come from, right? Number one, the laws had to be positioned to allow it. For better or for worse, a lot of the legislation has really been obstructionist to the development or the advancement of this industry until the pandemic. And then the doors kind of blew wide open, and everyone, myself included, had the opportunity to say, okay, what are we doing and why are we doing it this way? And how should we be doing it? Especially considering the constraints we had in 2020 and 2021. But then also the technology had to be there. We're talking about high quality access to internet and devices. In the early years of getting involved with telemedicine, the connectivity was terrible. Mm-hmm. And the accuracy rate with which we could actually connect with a patient was pretty low, and it was a miserable experience for everyone. And it's not that way anymore. So as the laws have evolved and the technology has advanced and people have started to understand that this is something that we need to have other ways to connect with our healthcare professionals aside from just physically presenting to their office. It has set the perfect stage for the explosion of this. And as a sidebar, like a little rabbit trail here, this is not new. Every other industry, we bank this way, we date this way, we shop this way. I bought a car online before and had it delivered to my house. So it's not like we don't know how to do this. It just hasn't, up until this point, had not been applied to healthcare. And now that it has, everybody who gets it says, oh, yeah, right. We should also do healthcare this way because our whole lives are this way.
It's really, it's a couple things I want to bring up, and I'll share a personal. By the way, most of the medical expertise that I lean on for my own health outcomes, they're all virtual. They're all digital. So I'm on the other end of the spectrum. Go see a doctor. Send me the labs. I'll do my lab stuff here, ship it out. We'll get online. You give me what I need to do, and that's great. And I love it. And it's from a time convenience as a busy entrepreneur, it's great. I'm able to leverage expertise outside. And I'll give you a special story, which is really important. My parents, who are in their 70s, who live in Canada, who I knew through genetic testing, had a high potential for having complications from the interventions that the government was forcing people into in Canada. And my dad, who had a stroke previously and had during COVID was actually had a open heart surgery. And I'm accessing data from the CDC, from institutions, the studies that were done in Israel early on, and a number of quote unquote banned medical doctors with expertise applied to that field, including a world-renowned vascular surgeon who's a friend of mine, where I asked specifically, is these interventions something that, what's the risk factor here? And there was a broad-based, centralized government dictate put down on people like my parents, which wasn't created for them as the individual, which is the doctor is supposed to be the intervener between the individual challenges. And I felt that was a violation of my parents' right to their own bodily outcomes. They suffered extraordinarily socially. They weren't allowed to go to a lot of places because I said, don't do this because we don't know what the potential outcome is. We were able to contact a medical doctor through telemedicine who was able to, I really went home, got online to help my parents get online. They had an aspect, they gave him all the information. He came to the conclusion that, you know what, this isn't an option for you, and was able to write them a medical exemption, something they could not access in Canada because doctors weren't able to write that for their patients or they would lose their license regardless of the care. So this is the piece I'm building up to this. So thankfully we got it. It's been great, and it's allowed them to move around and travel and experience their life on a better level. And the outcomes have been great. I'm not saying that's something for everybody, but in this case, it was the only option. You bring up something really important. The regulatory obstructions that is facing telehealth, and some of those are being removed, but then there's the other side of the equation, which are, depending on which state you happen to live in. Why do you think that's happening? Do you see those eventually falling away? Is there what's the reasons for all this, do you think, from your perspective?
Yes, let's talk about that, because sometimes if you listen to me talk, it'll sound like I'm dissing the government, and I'm really not. I think that people who are in the position to make legislative decisions are at a tremendous disadvantage. They are not healthcare practitioners. They only know what they hear. They only know what they're told, and they don't have a way to vet the validity or the accuracy or the quality of the information that's being fed to them, designed to help them make decisions. So to an extent, I really don't fault them. I find that, or my opinion as I've delved into this over the last several years, is that obstructive legislation, I think, comes more from a place of ignorance and lack of understanding why it should be important and how it should be important. For example, the whole phone versus video versus asynchronous, which is like a store and forward or chat-based or text-based way of delivering care. There are 7 states in the whole country that will criminalize me and take away my medical license if I don't have a phone or video visit. There's only 7, and there's 50 states in the country. So that means the overwhelming majority of the country allows chat-based, taking photos or looking at intake forms or dialoguing this way. I consider that a valid way of practicing medicine. But in the other 7 states, I can't. And so from my perspective, the thought is it really bad? Is it really harmful? Am I doing harm? No, I don't think so. So what's the difference in those 7 states? I think it's a lack of education, a lack of knowledge, a lack of understanding, and a lack of someone to truly communicate to them why this is important, which is why I always tell the strep throat story, which is all my 4 kids get strep throat at the exact same time. It's 10 o'clock at night. I'm a working mother of 4, and I can submit photographs of their positive strep tests, not have to worry about a midnight phone call, not have to worry about waking up my kid for a midnight video, but I can prove it through chat. And in the morning, I can wake up and go pick up my kid's medicine. That's illegal in 7 states. Makes no sense to me. But I think the more they hear those stories and the more the narrative of why this matters is presented to them, the more likely they will be to not be obstructionist. I hope.
Great point. Now I'm gonna lean on that a little bit more. And one of the obstacles is I've been in the holistic health industry, and unfortunately, the allopathic model and the holistic model are often at odds. And I don't understand why. I think they are both trying to achieve positive outcomes, and there's no point in throwing shade at the other, although there are areas that obviously people overstep their bounds, and I can see where people are critical of that, but they need to be able to not throw the baby out with the bathwater. We need both sides of the equation. And one of the aspects within our own and in my industry specifically is we are in an increasingly challenged regulatory box. And those regulations are being pushed by lobbyist organizations who are benefiting from removing the options of the consumer from choosing products and services in my field, so that it goes to fields where their outcomes are going to support the industries for which they're lobbying for. Is there any of that happening in those states, or is there an outcry from, say, maybe traditional medical institutions or clinics or things like that, or is that non-existent in regards to what's putting pressure to kind of make this flourish?
Yes. So the first thing I'll say to that is I want to back up your platform, what your soapbox, because as a classically trained allopathic physician, we are brought up in an environment of paternalism and lack of patient autonomy. And even though I've never been trained in the opposite or the alternatives to allopathic medicine, which is things like naturopathic, homeopathic, never been trained in that, I can acknowledge that people, humans, should have the right to choose what sort of care they're going to receive. If somebody wants to come to me and get evidence-based, statistically sound, what works for people, great, do that. But if somebody wants to go to someone else, which holistic medicine, naturopathic medicine, there is evidence behind that. There really is. The stuff works, but it hasn't been as incentivized by certain industries, such as the pharmaceutical industry, to propel enough research to show us what works. What I say is, if it works for you, do it. And so I agree with you, whether it's allopathic, homeopathic, naturopathic, there's a place for all of it. And we should make space. And when I say we, I mean at the regulatory level. There should be space made, and we should not be penalizing or punishing people who choose to practice alternative sources of medicine. So I'm totally there with you. Just want to say that.
Is there regulatory bodies and maybe industries, whether it's coming from the local, state level, hospital levels, or other, private institutions, who have a benefit of, having you actually show up in a medical clinic or a hospital, that are putting pressure on the regulatory aspects?
I don't have any way of knowing that. I think that I could figure that out if I really wanted to do a deep dive into who's who at the state board and like where their conflict of interest ties are. My assumption is, yeah, there probably is, because that's the way government and politics works. But I haven't looked. It's all about who you know and what type of influence they have and what positions they sit in, and high-level executives at places like insurance companies and health systems and giant hospitals. They do tend to have a lot of pull and influence, but I really haven't looked into that enough to be able to say, oh yeah, this is happening in Kentucky or whatever state.
Right. Exactly. So as a physician, moving into this model, what has your overarching, what have been the benefits, what have been the challenges, and how has it allowed you as a physician to be an advocate for telemedicine?
I'll start with the negatives. We'll lead with the negatives. It's been scary. It's been really scary, because as doctors and also healthcare practitioners, we are brought up in a culture of fear. You're going to get sued. You're going to get your license taken away. It's almost like too much stick and not enough carrot. Go faster, work harder, check all these boxes. I mean, it is such a punitive industry to be in. And when you step out into something even a little more gray or a little more new or a little more risky, although I've never seen it to be more risk, but it feels risky stepping out of the institution. We have a really punitive industry, and it can be really scary to say, okay, I'm willing to take this risk, even though I understand I have more exposure. I understand I might be at risk of getting sued, but I'm not going to do anything wrong to the extent that I have the ability to be aware of it. So I'm willing to take that risk. So that's pretty scary. Also, it is a new industry. Telemedicine, digital health tech startups are a little bit feast or famine. Companies close. Companies have upsides and downsides. And if you work for a hospital, there's always going to be work. So it is a little bit risky, because you don't know what the patient inflow is going to be like. And a lot of it is productivity based. And if the work's not there, then you don't have income, and that can be tough. However, the benefits are, number one, somebody asked me today, how do you attain work-life balance? And my answer was that the second that I disconnected myself from the institutionalized healthcare That was the best thing I ever did for my work-life balance, because as a work from home or 1099, I have the ability to choose. I can choose more work. I can choose less work. I can set my schedule. I can change my schedule. And I couldn't do that when I worked in the hospital. So I think that physicians who are getting burned out, NPs, PAs, anybody, healthcare practitioners who are getting burned out, moving into the digital health arena is definitely the answer. Second, it allows you to really be a part of change. A lot of healthcare practitioners, they went into their field because they cared about people. They wanted to change things. They wanted to care and do good. And frankly, working for an institution, you just don't get that. There's a lot of jaded people. There's a lot of folks who are not getting that fix in their heart. But in telemedicine, you're changing things for people. You're revolutionizing the industry, and you're being a part of the future solution. And for me, at least, it's kind of filled that void where I didn't really feel like I was making a difference in the institution.
Yeah, I think this is a common element that I've noticed with my friends in the medical industry, and I have a lot of friends in the medical industry. And I always say I would always say most of them, first off, are highly competent, conscientious people to begin with. It's very difficult to be a doctor. Not only just on the cognitive load, but in the duration it takes to become a medical doctor. And then from the responsibility paradigm, you literally have people's lives in your hands. And, you can't have a perfect track record. And invariably, you may make mistakes. There may be things that you can't do in regards to, where a person's patient care, and yet you receive the bulk of the criticism for it. Then there's the potential legal consequences, which you talked about. And then there's these centralized dictates, which I would say to my friends in the medical industry, it's like, I don't know why we're taking our best, brightest, most conscientious and most compassionate people and putting them into this structure of life where they have huge debts coming out of college. They have tremendous amount of time pressure. The culture is about, sacrifice oneself for the cause. And then these centralized overlords, which are locking them up and putting this fear, and then all this, and I was like, this makes no sense to me. Yeah. And I really feel empathetically for my doctor friends. And I was like, what's exciting to me about the telehealth model is now, as we remove people outside of those centralized institutions of control, now you have the operational efficiency and you get to determine how you're going to interact with life, which is very exciting. How do you see that implementing both on the regulatory side and also from a hospital side? We're still going to need physical locations, yet those institutions are going to have to change their model as more and more people say, enough of that. So they're going to have to make their environment much more attractive. Do you anticipate that happening, and how long do you think that will take?
No idea how long. I mean, I would say years. 5 to 10 years before we see real change, because you're talking about governments, insurance companies, and institutions. They don't change. Entrepreneurial digital health tech startups, they change daily, right? But that's not what we're talking about. Institutional change is going to take a very long time. And I think that what's going to happen is I think they're going to hurt. I think they're going to start to feel the fiscal burden of a lot of their care being streamlined out into some of the cash pay or the virtual health still reimbursed by insurance realm, because the patients are starting to catch on that the things that the hospital's mandating is not really required. And they're starting to understand and be empowered that they have options. And that's huge. But it's going to take a long time. And I do think that we will actualize a future just like the banking industry, where a lot of it is done online and some of it is done in person. And I really hope, and I think, and I believe that cost transparency will be a big part of this. Because as of right now, if you show up in the hospital, you have no idea how much it's costing you until you're done. You're already finished with whatever it is, and you go home, and 2 months later, you get a $30,000 bill that you're expected to pay. That's not the case with telemedicine. You know exactly what you're paying upfront, and you consent to that charge before you engage in treatment. And so I think that institutionalized healthcare is going to have to start being cost transparent if they are going to remain competitive and viable, because the American, in this case, American, but the patients are not going to tolerate being taken advantage of financially anymore.
I love that. And that's of course got to be terrifying for some of these institutional things that have kind of lived by, milking the ignorance of the consumer. And like, imagine walking into a store and buying a TV and they don't tell you the price till you bring it home. I mean,
and that's what it's like.
Yeah, like no one would do this going in. But unfortunately,
No.
When you're in a medical institution, you might be suffering from a life-threatening illness or a serious mental breakdown or something that's interventive in that care, and you don't have those options. They got to take care of you. And so it's a little bit taking advantage of. And the other piece of that is the doctor is only the person putting you back together, if you will. They're not part of the institutional billing component. They're also part and parcel to that machine. They're caught in it too. So they're just here to, hey, look, I'm here to put you together. The billing's handled by these people. The aftercare is handled by these people. I've got to put you together, right? I got to make decisions on the moment that's in your best interest, not relevant to the cost that care is going to be. So it puts you guys in a no-win situation, and that's a difficult. Once again, another a vice grip that puts. And I can imagine the emotional stress of that is significant as you understand that, especially as you get as a more and more veteran. You see, look, medical bankruptcy is one of the biggest bankruptcy reasons in the United States. What would you say is maybe the answer on the insurance side, or is there any variances on the insurance side? Let's talk about insurance, because how do insurance agencies deal with telemedicine and doctors who are performing telemedicine? Is that been easy, or is there complications within that both you, the physician, understand, and also what the patient needs to understand?
It's getting better.
Mm-hmm.
It is getting better, because a couple of years ago, forget it. There was no way to use insurance. Don't even try. It's not going to happen. If you do, you're committing fraud and paying money and going to jail. Nowadays, slowly but surely, because health insurance companies, those are institutions too, federal or private, they're still institutions. They're large, they have a lot of money circulating through their system. They're heavily regulated. They have systems and processes, and they're very slow to change. So they are institutions as well. And they're a key stakeholder in this whole theme that we're talking about, which is the advancement of telehealth. I have seen very encouraging improvements. Even at the federal level, Medicare and Medicaid, they're starting to reimburse for these visits. There is a lag, but we're getting there. And so I don't even want to diss on the insurance companies. I want to tell them that I'm proud of the work that they've done, because at least we're getting some things reimbursed now, whereas before it was none. And so I would say that we've made that progress, but there's still a ways to go. And I would encourage them to just keep looking at those policies, keep looking at what the trends in the industry are. And really, the insurance companies serves the doctors, the hospitals, and the patients. And increasing access to telemedicine care is something that all three of those things want. Doctors want it, patients want it, and institutions want it. So if the insurance companies can really look at how to expand what they're willing to pay for and how they're willing to pay for it, then we'll continue to propel this even more far forward to get more people more access, which is the point, right? The point is to take care of people more and better.
I love it. Now, let's maybe give I'm going to put you on the spot a little bit here, so you can always decline these questions.
Okay.
Which states do you feel are the most progressive in the United States, and which states are the least progressive in embracing this new model of telehealth?
And now for a Bioptimizers fixed digestion tip: supercharge your protein shake. Everyone knows protein shakes are a great way to sneak in extra protein, build more muscle, even replace meals and burn more fat. The problem is the highest quality protein typically absorbs at around 40%. One way to fix this and dramatically increase how quickly and effective your protein shake digests is to add 2 to 3 capsules of masszymes into your shake. One research study showed that pre-digested protein during a meal increased muscle growth significantly. To take advantage of this, just blend the open capsules into your shake, and within 15 minutes or less, the enzymes will have begun to break down the protein into amino acids. This can make your shakes at least 2 to 3 times more potent. Some people do this and sip on their shake while lifting to provide their muscles with a steady stream of amino acids during their workout. To save 10% on masszymes, use the code SHAKE10, that's SHAKE10, at masszymes.com. That's SHAKE10 at masszymes.com.
Happy to do that because they know who they are. I'm not saying anything that they don't already know. My 2 favorite states when it comes to openness and progressiveness are Oregon and Colorado. Round of applause for Oregon and Colorado. Mm-hmm. And what I love about those 2 states, and there are others, I'm not saying that there aren't other states that aren't great, but from my experience, those 2 are the ones that have the most trust in their providers to say, we trust that you're doing the right thing, you're using the proper modalities, and we give you the freedom to use technology to establish relationships with your patients and provide appropriate prescriptions, advice, labs, whatever the thing is. Love those states. The ones that are a little more painful, the first one that comes to mind is Idaho, is very overlordy.
Mm-hmm. Yep.
And I don't know how else to say it, except for the fact that I've written the Idaho government before. I've shared my stories. I've begged and pleaded, and I'm not asking for anything different. I'm asking them for them to align themselves with the states that are around them. Washington and Oregon and Montana and whoever borders them to the south. I don't know geography that well, but they're all more progressive. Why? Right? West Virginia is still holding out a little bit. Washington, D.C. and Delaware, they're still a little bit on the stricter side. Mississippi, Louisiana just tightened down their laws a little bit. And I don't really understand it. There's always bad actors and there's always doctors and companies doing the wrong thing. But by setting overly restrictive rules, they rob us, me, and my colleagues of the ability to be able to innovate and to be able to change and to be able to grow and to be able to take care of the people in their jurisdictions. Why is it that our nation's capital has poorer access to digital healthcare than places like rural Oklahoma? Why is that? It's unacceptable. And so I love them. I'm licensed in all 50 states. And I should say this out loud. I respect and obey the laws, right? I will do in Idaho what Idaho says I have to do. And I will do in West Virginia what West Virginia says I have to do. Even though I respectfully agree to disagree, I will still obey their laws. But it breaks my heart because I know that the people in those states are suffering because they're not given the opportunity to choose, and they're not given the same access to digital healthcare as their brothers and sisters and their friends and colleagues all across the country.
From an economic perspective, let's kind of go there. Do you feel that for the consumer that telehealth actually brings the price down? And do you feel that accessibility of telehealth is improved for the consumer? And are they concording with each other or are they at odds?
Yes to both. Some of it's opportunity cost, right? Because it's not just the dollar signs. Some of it's opportunity cost. So for me, let's just talk about me, right? I can do cash pay telehealth. There's all kinds of services out there all across the country. You can use whatever service you want. The one I use, it's about $65 per visit, right? So if everybody in my household gets influenza and I decide I want to treat the kids, it's about $250 or $300 cash. However, I'm not losing work. I'm not spending gas money. Mm-hmm. I'm not eating out because I'm not taking them, because odds are if I go to the clinic, we're probably going to stop at a drive-through on the way home. I'm not pulling them out of school. I think I already said I'm working. I'm saving a copay, which if it's 30 or 40 bucks a kid, and I've got 4 of those, I've already ate up half the cost of a telehealth visit, right? So for me, in my mind, the actual cost plus the opportunity cost, there's no question. I'm saving money by doing telehealth. And I'm not taking them into the office, which means they're not getting sicker, because we always bring something home if we go to the pediatrician's office, which means another round of doctor visits and another round of missed work. And all that opportunity cost just kind of resets itself. And from November to February, you can really get stuck in this black hole where there's a big expense on it. So for me, and do I think they're in sync? I would say the cost of telehealth is decreasing. It's a supply and demand curve is what it is. As demand increases, the supply is also increasing right now, but we also have the market economics of competition. So the more companies that come into the market, the lower their costs have to be, because the people are going to go get their UTI treatment at whatever's the cheapest place. They don't care unless you develop some brand loyalty, which takes time. People who are having that first entry into the digital healthcare system, they're looking for who's cheapest, fastest, and most convenient. Capitalism, right? So yes, I do think the costs are coming down in accordance with that increased access to care. But I mean, for me personally, it's an absolute hands down. I will save money every time doing virtual health.
Well, then also there's another aspect I think that's pertinent. I mean, if you're a medical doctor living in Los Angeles or New York City or these high density areas, which there is extraordinary cost of living consequences, versus living in a more rural area as a medical doctor where you still have access to those markets from a density perspective, but you're able to, offset what I call location arbitrage, that maybe you can offer service in New York City to a person in New York at some fraction of what local costs might be. And you get a concordant benefit because the relative value that you can charge in New York isn't the same as what you would get in, say, Iowa.
Yeah.
So is that making the industry attract, or you can also the benefits of living in a small town, for example, and there are things. So what are those decisions on both what you can make as a physician and where you can live and the time efficiency or work-life balance? How do you, as an advocate of telemedicine, I would put you as an advocate. I'm an advocate.
You got it. Yep.
And I'm asking these questions for all my medical doctor friends who are concerned about it or considering this and going through that fear phase because oh no, I'm breaking from the punitive centralized dictates, right? What has that been like? Can you expand on that a little bit? And how does that work out for you? And what does that mean for you as a physician and your capability or capacity to provide care for your patients?
Yes, no comparison. As a virtual health physician, I have access to every single market in the country because I've chosen to get licensed in all 50 states plus DC. And there are several people coming after me that have chosen to do that as well. I don't mean like coming after me like they're coming to get me. I mean, the future generations of, I should specify, the future generations of virtual health physicians that are growing up behind me are realizing that this is something they need to do. I can practice, and I do practice in every single market in the country. The financial implications of that have been incredible and unlike anything I could have ever imagined. There is no way that I could even compare. I mean, if you're a doctor listening to this thing like, oh, how am I going to replicate my salary? You will 5 times over. If you have the bravery to step out and say, I'm going to try this, I'm going to do this, I'm going to get some state licenses in the big jurisdictions or all the jurisdictions, and I'm going to lean all the way in, you'll be so marketable and you can instantly match your hospital salary and never have to leave your house, much less like gig work and 1099 work. I mean, the beautiful thing about it is you can layer your career And you can find places to put that extra work in the white space or after the kids go to bed, or there's even some passive income opportunities out there where it doesn't require much than a name and a license, and still totally legal, totally, within the guidelines of what's feasible to do. The career opportunities are exponentially more available to you than they are working in institutionalized healthcare. But you got to be brave enough, and you have to be an entrepreneur in your own mind, because I am a business. I am the CEO of the business of me. And so I have to be willing to invest. I have to be willing to take a risk. I have to be willing to be innovative. When I think about how I do my career, I have to innovate within my own career. And that can be scary. I acknowledge it's not for everyone, but for the people who are on the fence and they're like, I really want to, but, just do it. Just do it is what I say. You have nothing to lose, and the institution will take you back anytime. They'll suck you right back in.
So two elements that kind of emerge out of that in my mind is, what would you say the differences for a physician operating a telehealth business as opposed to working with an established institution, from billing an organization to the hospital, like all that sort of stuff? Because I think you probably get some administrative training, or you're in a clinic that has established best practices already that you can kind of borrow off of versus being at home. And then the second question I have a tendency to load these things up, is if someone is a physician and considering that model, is there a transition period where they can work both sides of the equation until their new business is established? Like, what's your suggestions around that, or do they go all in?
No, I had a 5-year transition period.
Mm-hmm.
A 5-year transition period. You got to be willing to work hard.
Yes.
And there's an element of self-sacrifice involved, but that's what it's like being an entrepreneur as well. So I had a 5-year transition period. Yes, you should transition. Absolutely. And what was the other question?
Well, what were the things that were different from an entrepreneurial perspective as opposed to working for an institution where a lot of maybe those entrepreneurial activities are already built into the machine that people are fearful to exit from? You got the clinic, or you got the hospital setting, you got your assistants, you got this whole kind of machine that has been operating for 100 years or 10 years or 50 years or whatever along that institution that you're with. How do you overcome, say, the uncertainty about developing these systems for yourself?
It's scary, but it's not anything you don't know how to do. You're a doctor. Come on now. You went to 75 years of higher education. You can take out appendixes. You can deliver babies. You can, handle sepsis. You can keep people from dying. You can learn how to manage your own life. It's the easiest thing you've ever learned how to do. But you've got to be self-motivated. Nobody's going to do it for you. You've got to be self-motivated. You've got to learn how to handle your finances. You got to learn how to do self-employed taxes. You got to learn how to manage your calendar. And you might have to learn how to delegate. Maybe you need an assistant. Maybe you need some administrators. Maybe you're building your own organization with you at the central focal point. But again, it's no different from being an entrepreneur. There's tons of courses out there, books you can read, networking groups online where there's other people that are just like you trying to break out of the institution and get into more alternative careers or non-traditional non-clinical careers. But you do have to be motivated, self-motivated, self-driven, willing to take a risk taker. You cannot be risk averse. And that's not this. I'm not saying go rogue and start breaking laws, but if you're wholehearted, don't do that. Don't do crimes, right? Like, don't do crimes. Don't break the law. Obey the regulatory boards at all costs. But if you're not willing to assume a little bit of risk, then it's probably not for you. But I would highly recommend just giving it a try. I mean, you have nothing to lose, especially if you don't break the law or do crimes. You have nothing to lose, really.
I love the fact that telemedicine is opening up expertise and care to people who may have a lot of difficulty. I think of older individuals or incapacitated individuals that are long ways from, institutional or centralized institutions where they go in to see a doctor or get a medical care. It's a big issue in Canada, for example, because we have vast spaces where, and many of the new doctors aren't hip to go to a rural area. So we have a lot of people that don't have access. And then going back to my parents' case, they were very, tentative about, oh, I'm going to be online and talking to a doctor. Is this person a real doctor and everything? And they literally went from that to 2 hours later, after they both had their hour consultation, they were like, wow, that was awesome. And the doctor was so nice and provided all those personalized aspects that a real medical practitioner can provide. And a lot of that is in assurance and clarity about complex issues that's outside of the range of that individual. Do you see, how fast do you see this becoming the primary form of care versus kind of the outlier of, oh, I don't know, or it's a possibility? But how fast do you see that happening?
It's already there. It's already happening. It has happened. But I think what we're missing is adoption. So that's why I'm so loud about this, because I want everybody to know. I want everybody to do it and everybody to try it, because it's already there. You can get 75% of your healthcare from someone through a virtual platform. And you're right, advice, compassion, wisdom, and support goes a long way. And let's be honest, were you getting that from your brick and mortar doctor?
Mm-mm.
I wasn't. I've seen my PCP once. Love him. Great doctor, totally competent, excellent individual. But I wouldn't say that we necessarily have a relationship.
Right.
My patients feel like they have a relationship with me in a different way, because they can reach out to me at any time. I will respond to them within a couple of business days, depending on the day. And we get to talk about these things. We get to make these relationships, and I'll let them know if I can't take care of them and I think they need to be seen in person. We have that conversation. But it's a whole different definition of a doctor-patient relationship that's a lot more human, and it's already here. It's already here. We just got to blow it up.
It kind of reminds me of, as we like to say where I'm from, back in the old days, the doctor would come to your house and would, provide the care that you required. And it was quite common. And I think doctors became revered inside of communities as, some of the most important people in a community, in that they were able to provide insight and care during some of the most difficult aspects that it is to be a human. Because essentially, especially we're dealing with palliative conditions or severe pain. And there's not just an impact on the individual, but the family that's involved in that. And what was really interesting is, in this situation where my parents were under a considerable amount of stress, couldn't get access to the care that they wanted inside of the centralized institution, were outcasts in society, were not able to participate as other people inside of the country. And all of it, literally I can remember this. I did this at Christmas time, and I have a tradition of going out with my father. And I take my mom one day and my father the next day. My dad and I always go the day before Christmas. We go shopping. It's kind of a father-son and a mother-son event. And they weren't able to do that because they weren't allowed to go into restaurants and things like that, because we always go out for dinner and stuff like that. And I got them, when I got their paper from the doctor, they had an exemption. And my father and I, the day before Christmas, went shopping. We went into a restaurant. It was the first time he had been in a restaurant in over a year. We went into that place, and they said, "Do you are you this?" And he says, "Oh, I have a medical exemption." And the lady's like, "Okay, great. Well, have a seat."
Yeah.
And my dad's sense of autonomy that went up right now, I could see the effect after, and he went into almost a state of euphoria. And we had lunch, and he was always just the little things in life that was super aspect. And what I love about telemedicine is I think it gives you, the doctor, more time, because you're dictating the time clock here. You're not under some sort of, hey, 8 minutes, that's it, you're out the door.
Right. Move on.
Move on, write the prescription and boot the next one out because we got to hit this, load for the day. To, again, becoming the trusted advisor in the most difficult aspects of life, the things that, they don't want to share even with their spouses or their kids. You're in that position of authority and influence and literally of wisdom. And I think more of that is exciting. And I believe that you're right. I want to say all that because I believe that you're right. I believe that the empathetic side of the doctor, which is what usually gets driven into the industry in the first place, now gets to shine forth from this capacity to meet one-on-one digitally. And I love it. I think it's great. And that's why I have all my doctors. They're all virtual, right? And I love it. I want to touch on one place because I know there are some criticisms, and it wouldn't be prudent or wouldn't be fair if I didn't address one of them. And one of them that I heard recently was kind of bizarre, and I don't know if it's true. So I would recently I heard that they have these, and I'm going to go into a murky zone here. So if you don't want to answer, that's fine.
Go for it. Let's go.
Recently, because of the transgender stuff that they have in California, someone from another state can call telemedicine in a medical thing, and then the kid can be taken from one state into California and issued transgender surgeries through telehealth that might not be available in that community. And this can have impact on the custody of the child in that state. So, for example, if you're in a state where transgender or gender assignment surgery isn't allowed, and one of the parents, let's say the parents have shared custody of the kids, one of the parents says, no, my kid says that they want this. We call this doctor in California. They go to they get their treatment from California. And if the other parent is in objection to it, they can have the child removed for them by the doctor in California from child care services. So that's kind of like the worst nightmare situation I can imagine. So is there potential regulatory bind? You don't have to comment on that specifically, but what are the potential regulatory binds that could occur from the differences in states? You kind of touched on it, but what are some of maybe the top 5 things or top 3 things that you can imagine?
I don't know.
Yeah.
So my extent to be able to solely within the medicine, I have had hundreds of thousands of patients and I've never heard of that happening before. Does it mean that it hasn't happened? No, I guess not. It doesn't mean that, but I don't know enough about child custody laws and like location of child and like giving or revoking custody. I don't know.
Okay, that's fine.
I just don't. That is not a type of law I have ever.
It's new. It's a relatively new thing that just emerged. And I was like, because I'm living in California and I read about this and I'm like, is that true? Does that really exist? That's crazy.
And some of those laws have nothing to do with healthcare, right? The custody and the child custody and all that is not a healthcare law. That's a family law. That's a domestic law that has nothing to do with healthcare. But what I could say is the physical jurisdiction where you are located when you are receiving the care is the law that applies.
Right.
Abortion care is where we see this happening a lot.
Right. That's a great one. That's a great one to examine. A handful
of states where you can do any abortion at all, but also telemedicine. And if you are physically located in California, Colorado, Illinois, Washington State, I forget the rest of them, but that's a handful. If you're physically located there, you are a patient of that state. It doesn't matter where you live. It doesn't matter where your driver's license is. It does not matter. The jurisdiction that you fall under is the state where you're physically located at the time that the services are rendered. So it's a great example. I'm a doctor in California. I'm just going to pretend, right? You have a California medical license and a patient's in California and they want to receive abortion care and they go to Planned Parenthood and they get their pills and they choose to go to Texas to take them. Number one, why would you do that? But number two,
Right.
but for the sake of discussion, the doctor's not at fault. You were in California with a California licensed physician receiving a treatment that's legal in California. And you chose to go to Texas and then do something illegal. It's illegal in Texas. You've committed a crime. The doctor didn't commit a crime. The doctor had nothing to do with the fact that you went to Texas. And so you can be held liable where you wouldn't in California. And yeah, that is actually the way that it works right now, but it's a state by state jurisdiction, and it's only where you're located that law applies.
Well, that's very interesting, because you could get into also, like, say, cannabis prescriptions, which are legal in some states and illegal in others. There's no federal jurisdiction over that, but you could run yourself into potential problems if you don't understand that. So what would you say are the tenets and you kind of touched on it, but I want to just clarify the tenets for the doctor and the tenets for the patient of how they communicate or navigate the interstate variances in regulation?
Not the patient's responsibility at all whatsoever. Do not go read regulatory laws, patients. Don't read the laws.
Right.
Don't do it. I wouldn't expect you to do that in the hospital, and I don't expect you to do that in telemedicine. It's not your job, right? Just like we don't read information security laws, we don't read banking laws, we don't read those laws because we don't need to read those laws. But it is the responsibility of the doctors and of the companies that the doctors work for to make sure that they understand the legal and regulatory environment that they are working in because that's a part of taking care of your patient. Making sure that your patient's not breaking the law is your obligation if you choose to practice digital medicine. So it's my responsibility, it's our responsibility to make sure that we create our virtual offering and all the things that we do in accordance with the state laws that we are choosing to operate in and not do harm, because our Hippocratic Oath says do no harm, right? And that doesn't just mean healthcare harm, right? We can keep them out of harm by obeying the laws.
Excellent. And then the next thing, so there's two elements that I thought was interesting. I read a book by Yuval Noah Harari, who he wrote a number of different books. One's called Sapiens, which is the evolution of humanity throughout time. And then he's got Homo Deus, kind of the godlike tendencies, and then something about the 21st century innovations. Well, what was interesting is he was talking about the development of technology for surgery and being remote surgery, in that they have robotic equipment where a surgeon in New York City could be working on a soldier on the battlefield on another continent through robotic technology, and that this is becoming more prevalent. Do you see potential from the surgical side? I know you're on the more patient care side, not as the specialist, but as the general practitioner, I'm assuming, with certain. Yeah. So do you see potential facilities where people would be put into a surgical situation and literally the doctor's in some other place and there's robotic equipment that is actually performing the surgery? Do you see that? And how long do you think that will be before that becomes realistic or applicable?
No clue. It'll be as fast as the technology can be developed. The most exciting thing to me is that the technology is already being developed, but those innovators will play their cards close to the chest, and they will not release their idea until it's fully baked and ready for execution. But yeah, I hope so. I hope we have virtual remote surgeries and find a way to save lives that way. I think it's already here right now. I go to all the major conferences and I have my eye on what is coming out, but I think it's going to be sooner than we think. And it's going to be really exciting because it's access to care and saving lives faster than we already could. So I'm fully on board with all of that.
So what are some of the areas that you are most excited about in the industry of what's coming in the future for humanity?
Most excited about, the thing I'm most excited about is medical records. I want to see medical records taken away from the institution and given back to the patient to have autonomy of who, when, where, why, and how to share it. I don't think it's fair that the hospital has my medical records and I have to get their permission to share it. Number two, I really want to see us really leaning into all of the types of care and all the demographics that we've been afraid to touch. Like today, I had a conversation with a company about HIV and hepatitis C care, which is something that we have not done through telemedicine. And they asked me, how are we going to do this? My response was, I don't know, but we're going to figure it out together because we're really going to be the first ones. And that's exciting. So I'm excited to see that. Also, inpatient care, nursing home care. We're going to take it into the institutions and learn how to integrate this hybrid model of virtual and in-person care to, again, it's increasing access to care, increasing the doctor's capacity, and leveraging technology and new devices to make it happen. It's going to be so exciting.
That's great. And I guess the final question I want to ask is, I'm in the human optimization side of the equation. So virtually all of my medical treatment is not necessarily, hey, I'm trying to treat a condition. I'm trying to optimize every function of my body and looking at genetic predispositions, risk factors, human nutrigenomic interventions that I can perform. And also whether, cognitive enhancement. I haven't stepped into the hormone optimization. I've been trying to kick that can as far down the road as I get, because it's fairly final once you go down that road as a middle-aged man. Anyways, it seems to me that as a GP offering telemedicine, that you're going to be able to really kind of chart your course much more than you would be if in an institution. Would you say that's true? And that's also exciting because you can kind of stay up to date. It's very hard for institutions to stay up to date, but as someone who dictates their time as well as their interest, you can kind of specialize in various areas. Do you see that as another option that telehealth provides more capacity for?
Yes, especially leaning into integrative health, functional medicine, and preventive care, which is what you're talking about, regenerative wellness promotion, anti-aging, and things like that. Yes, a resounding yes. Why are we waiting until our patients get sick to do something about it? That's a whole nother soapbox, but yes, I do get to choose. I get to choose what I learn. I get to choose what I practice. I get to choose what I do, and I get to choose how I take care of my patients. And as long as I'm not harming and I'm not breaking the law, it's well within my purview to do that.
That's super great. I'm super excited about this field, and you've been so gracious with your time with us. Can you share with our listeners where people can find you, how they could leverage your services if you're still taking on clients, of course, and how do they find out more, social media, all that sort of stuff?
Yep. So I for those of you who know me, I wasn't until very recently findable online, but I do have all the things that an adult in society needs now. I do have an Instagram at America's Favorite Doctor. That's DR at the end. And I have a website, which is currently a splash page, but it's being built, which is www.drlaurapurdy.com. And that's drlaurapurdy.com. It's a splash page, but you can see on there, become a patient of mine or contact me. And I'm also on LinkedIn, just by my name, Laura Purdy, but you can find me in any of those places. I love to meet people. I love to chat. I'm always taking new patients and love to work with you to optimize your health or get you taken care of with what you need. It is all cash pay. We don't do insurance right now because, as we've learned, institutions are hard to work with. But yes, I'm always open to taking new clients or patients or associates.
This has been awesome. And I'm so excited both for you and the industry, as well as the people that can take advantage of it. I personally use this industry. I'm an advocate of this industry. I only see it growing and providing more personalized care for people and a better lifestyle for the physician themselves. And I think that's really important. It's both sides win in the equation. And it's just been great to have you on here and to advocate for this and to explain it, both for patients and for our doctors out there. I believe that the insurance paradigms will change, and I would suspect that when we get into longitudinal studies, we're going to see better outcomes from telehealth than we are from our institutional awareness, and that's when the script will completely change. So thank you for being on the cutting edge, the bleeding edge, the frontier, out there advocating and taking the time to help both our patients and our doctors. It's been great. Thank you so much.
Thank you so much for having me, and I look forward to the future ahead of us.
Thank you so much. And with That, folks, that's another edition of the Awesome Health Podcast. Of course, I'm Wei T. Lightheart. You can find all our information at bioptimizers.com and, of course, our Awesome Health course. And if you are thinking about giving telemedicine a shot, well, this is the place you want to go. Why not talk with America's doctor, Dr. Laura Purdy? You can find her on the links located in this. And if you like this, or you know someone who might be looking for a medical practitioner and can't find one in their local area, guess what? All you need to do, get on your computer, dial up Dr. Laura, and we're ready to go on this program. So thank you so much for joining us today. Like, share it, especially with the people that you love. I'm Wei T. Lightheart from Bioptimizers. Take care.